Good morning. I am with Dr. Jeffrey Anderson from the Intermountain Medical Center Heart Institute. Welcome as we talk about the American College of Cardiology scientific session, and we talk about some of the late-breaking trials. Let's talk a little bit about some of the trials that will be released and some exciting developments that they may provide for us as scientists.
Jess, you're exactly right. For the last many years, these late-breaking trials have really been some of the highlights of the meeting, where major trials are presented that can really change our clinical practice. And our center was involved with two that I'm particularly excited about. Let me just mention. One is called GIFT. We've been working in this for about 8 years. But the idea here is, can we better modify our approach to treatment in patients based on their own personal genetic information with a common anticoagulant called warfarin in patients getting hip and knee surgery. And so that will tell us by testing some genetic markers if we can modify the dosage and approach to treatment, if we can improve their outcome, reduce the risk of bleeding and clotting and so forth. So that's very exciting. It's a 1,600 patient multi-center trial that we had a major involvement in, and I'm very much looking forward to that one. Another one, apart from the arrhythmia area and so forth, is the FOURIER trial, which deals with coronary heart disease. And the idea is, if we can lower cholesterol by a different method than statins, this particular class of drugs is called PCSK9 inhibitors, can we in fact reduce events? We've shown that we can do that with statins, but can we do it with another approach to lipid lowering? And that will be the first major outcomes trial. And it's already been announced that the results are positive, really exciting, but we don't have any of the details, and that will tell us about it. And we were one of the enrolling centers.
How exciting. What about some of the other research that will be released during the scientific
Well,
session?
we have 8 abstracts from our center. I'm very interested, of course, in the work we do, and then we can look to collaborate with other centers that are doing areas involved in similar areas of research. One area that we've been involved with, for example, is risk scores, and we have our own Intermountain risk score, and now we're just applying it to different groups of patients. We have 3 or 4 abstracts that have extended that interesting concept of using very simple laboratory and physical examination findings, combining them to risk score to provide very powerful risk predictors.
Well, how exciting. We appreciate you joining us, and we look forward to the results of these studies.
Great.
Thanks.